My name is Melissa Schneider. My friends call me Missy. I was born and raised in Rosendale, Wisconsin. I'm a Packer fan and enjoy playing basketball and other sports. I was on the Laconia High School girls basketball team. Staying active and healthy have always been a priority. Following a basketball injury in 2008, I met Dr. Alan Rucker, an orthopedic surgeon. Dr. Rucker and his team were amazing. While they repaired my knee ACL tear, they also opened my eyes to healthcare. They explained everything about my healing process in a way that was understandable and fascinating. The physiology of the whole process was intriguing to me. That interest was further enhanced during a school assembly focusing on our area's Youth Apprenticeship Program, an opportunity for me to work and be exposed to the healthcare and patient care firsthand. I could apply, interview, and start the selection process to become a CNA or Certified Nursing Assistant at St. Agnes Hospital. That sounded like exactly what I would enjoy.
The High School Youth Apprenticeship Program, or the YAP program as we call it, is an opportunity for area high school students when they're in their junior or senior year to experience a multitude of healthcare careers. They go to school, learn here, and get paid for the work that they do in the 2.5 hours per day that they're here. In addition to the Youth Apprenticeship Program, we also have a CNA program. The CNA program that we offer is unique in that it is completely paid for. We hire people into a position that's open and then train them to become a CNA. We pay for their class time, their study time, and their uniforms, offering them the opportunity to enjoy the career choice that they've just made.
Once I started as a YAP student, my days started much earlier than my classmates. Each school day, I started at St. Agnes Hospital at 7 a.m. During my nearly 3 hours on site, we would study, train, and learn to become a certified nursing assistant. Not only did I get on-the-job training, I got paid. I would finish my day at Laconia High School and participate in sports and other activities.
Our YAP students are typically amongst the brightest and best. Their experience with the program does not interfere with their high school experience. It actually enhances it and is a great thing to put on their resume.
After my CNA certification, I was able to shadow professionals and providers in many healthcare departments. Agnesian Healthcare is a special place to work. Not only focuses on the family and patient, but on the continuum of care. Just like when I was cared for by Dr. Rucker and the orthopedic team. Working in multiple departments helped me understand how patients are transitioned effectively from one area to the next. I saw how patients benefit from this approach. I spent time in the lab as a phlebotomist, in medical imaging, food service, medical units, patient transport, adult daycare, physical therapy, and St. Francis Home. I developed a respect for all providers who trained me, and that respect was returned to me. My education continued as I was accepted to the University of Wisconsin-Oshkosh Nursing Program. A CNA certification is required to be accepted to this program. I was already ahead of the game with 4 years experience under my belt. I was part of a clinical immersion program, working one-on-one with an emergency department nurse. I was hooked. Emergency medicine was where I wanted to practice. The fast pace and interactions are fulfilling to me. You are able to assist families and patients in a manner that is calming and rewarding at a critical time in life. After completing my college degree, I served as a nurse extern at St. Agnes Hospital Emergency Department. My years as a YAP student gave me a foot in the door. I was making a difference.
We were happy to offer Missy a full-time permanent position here at St. Agnes Hospital. She is an asset to our team. She is able to incorporate the mission into her patient care.
My opinion is respected, and that means the world to me. My feedback is appreciated and taken into consideration. It is comforting to our patients when they see our whole team working together. I would like one day to be a flight nurse and to go back to school to become a nurse anesthetist. But for now, I am celebrating today.